Hi everyone, I am Anita Dilip. Welcome you all to yet another episode of Conceive. Today we have the well-known infertility specialist Dr. Anita Mani here with us to discuss you about various infertility issues. Hearty welcome you ma'am to the show. What shall we going to discuss today?
Today in this episode of Conceive, I am extremely happy to have Mrs. Anita Dilip with me. She is actually a principal of an international school. So, when I was looking for somebody to actually do an interview for me, I was thinking about I need a female angle to the fertility issues, because these days, as we all know, women are working too much. And when I came to know that Anita is doing so many things in her life, I thought I have to do this topic. We have to discuss the life changes of women these days, the career development, what is happening, and how do we build a family, and how do we delay a family building in this process of development. So we are going to discuss about the biological aspects of aging in a woman and how it is going to affect her chances of getting pregnant, how the effects of pregnancy on her aging health, and the social issues related to the late age pregnancy.
Ma'am, as a woman, we all have a doubt. What are the problems in delaying childbirth?
It is quite difficult to decide at what age a girl or a lady or a woman, it's very difficult to actually describe. The transition from one stage to the other has become so different these days. We have an age of marriage allowed at 18 years. You can vote at 21 years. But when does a girl become a woman? It's very difficult. Biologically speaking, I would like to give you a little bit of biology lessons here. Women or a girl child, when it is born inside the uterus, when it's a newborn baby, at that time the number of eggs or the gametes which are going to become a baby in her later life, it is actually present at the time when the baby is inside the uterus. We have around 2 lakhs of eggs in each ovary. Ovaries are the glands which produces the eggs when the baby is born. This is in sharp differences between men, because the male gametes, that is the sperms, are produced throughout their life. So what we have here is, we have the eggs present in a fixed number. It's like putting money in the bank. It is fixed. There is no more egg production after the girl is born. So these eggs are in a very small immature form, and as a girl reaches the puberty, when there are hormonal changes in the body, the same eggs which are in the immature form, each month a few follicles get recruited. So it's like you are recruiting soldiers for a war. You recruit 10 people, 20 people, like that. So each cycle around 5 to 6 or even 10 eggs are recruited, and usually only one egg will grow, and it will get ruptured in the form of ovulation, and there is a chance of pregnancy. So what happens is that, you think about this, like if you have money in the bank, say you have around 10,000 rupees in a bank, you are taking 1,000 rupees every month. You do the maths, how many months do you have? It will get depleted after some time. There are no money left in the bank after some time. So in the same way, the number of eggs are constant. So every month a particular number is recruited, and then it is ruptured, or the others are degenerated. So the number of follicles which contains the eggs, they keep coming down as the age goes on. So the best eggs or the good quality eggs which will respond first to these hormonal changes are obviously going to come in the early years. So we have a highly fertile period which will last around up to the age of 25-26 years, and then slowly, which is a gradual change, you are going to get lesser number of eggs because you have less number of reserve, and you have a quality which is not as good as the early year eggs. So you are going to get a period where you have a slowing down of fertility. So that actually starts not at the 40s, it can start as early as 26 or 28 years. So at that period you will have lesser number of eggs which are not as good as the early ones. Then what happens is that as the woman reaches the age of 32 to 35, this number is going to come down even further down. So the recruited number is going to be less, and then quality also comes down. After the age of 36-37, the women may not have enough eggs that they may not even have ovulation every month. So they might have a little bit of dysfunctional uterine bleeding, that means irregular periods. Some women have irregular periods even before they go through the menopause. If the reserve is not very high at birth, like some women have less number of eggs, they might actually even stop having periods at that age. Some women go through premature menopause. If the reserve is high, as some women do have, they might even have good quality eggs up to 37-40 years, but this may not happen every month. So if you take an average woman, you see a cycle where you have good number of eggs, and most month you have ovulation up to 26 years, and then gradual reduction by 32, and few months ovulation a year, or even no ovulation by that age. So average woman tends to have a high peak and then slow reduction in her fertility. So 26, as I said, sounds very early, but 26 to 28 is top limit for excellent quality eggs in many women. So if you are looking at getting married in the 30s and 35, we can see that there is a gradual reduction in the fertility at that stage, and there might be issues with subfertility or infertility. So there is a biological clock, and it is ticking. And then you might ask, like, people are having children at the age of 40, even at 45. It's true that some women do have children at that age, but then, as I said, there is a lot of variation in the number of eggs in each person. So there might be people who have more number of eggs, and it might be that some cycles they might be having good eggs. So it is still possible to have child at 40. We all know that the risk of abnormalities are quite high at that age. This explanation shows that you have poorer quality eggs at that age, which is causing the abnormalities like Down syndrome in elderly women. The chances of having a Down's child is 1 in 10 after the age of 40. So now we have a biological lesson that the fertility is coming down. But looking at the social issues, do we ask our girls to have child before 25 years? It's a big controversial subject. So I want to have input from Mrs. Anita, who is a career woman, in that subject, and I would really want to have a nice discussion on this topic. When should somebody plan for a child? It's irrelevant these days discussing that when should a women get married, because you don't really have to get married to have children these days. But I really want to discuss and see what are the pros and cons, what should a woman do, what should we advise our girls. So let me ask Mrs. Anita her views on the age a woman should plan for her child.
And this question is really, a tough question because the answer may vary from people to people. I think am I right?
Yeah, that's very true.
Because I'm basically a counselor too. So I used to meet many women for their various issues, familial issues. So then I would like to think about some cases which came to my point
Yeah.
and to my attention. Because women's, their maturity level, they get the biological maturity in an early stage.
Yes.
But how far, they are getting this, mental maturity, that is different.
It's
at
very
different
true,
point
very
of time.
true.
And then that may affect various factors, depends upon their education, the family circle, their life experiences, the environment where they belongs to. I think
Yeah.
all these
The cultural background, I know.
background is really
Yeah.
really affecting it, right?
Mhm.
When we think about a woman's maturity level and the life experience.
So you think that women should be mature to have a child? That is the point. Do you think women should be mature to have a child?
I believe
Yes.
because when a woman is getting conceived early stage, soon after her marriage, sometimes she may not be
Ready to look
ready
after
to
a
look
baby.
after a
Yeah, I
baby.
know. See, having a baby is not a small thing. You have to look after the
plan their
needs
life, right?
needs of the baby, and she needs to take care of herself.
Physically, mentally,
Yeah,
emotionally,
she needs
a
to actually
woman
take
has
care
to.
of herself in pregnancy. She needs to have a healthy pregnancy herself. Only then she's going to have a healthy baby and healthy childbirth.
And moreover, I think a woman has to be ready physically, mentally,
Physically,
emotionally.
yes,
to conceive
very
a
true,
baby. Am I
very
right?
true. So, what about her career? That's something I
Yeah,
want
that
you
is,
to put input
that-
into.
that
Do you
is-
think that a girl should get married while she's doing? We all know that nowadays to finish a graduation, you have to wait till at least 20-21 years, and then you need to have a post graduation.
they have
It's
to go for
24-25.
Yeah, yeah.
So,
Then their
what do you
career,
think?
sometimes-
Yeah, what
but
do you think?
Familial expectations, sometimes they wanted to get this girl child to get married early stage, but their expectation and parents' ambitions are really mismatched.
So, we have a dilemma here where we think that should a girl get married early and then study, or she should have a child and then study, or should she wait till she finishes her post graduation and masters and get into a job and settle? What according to you, what do you think a girl should do? I'm actually questioning my interviewer.
I suggest definitely after their professional studies and set into a career, so that their experience, they'll be highly enriched with various life situations, and that will give a lot of
and then maybe she's also having a stable partner. I mean, these days you can't really say husband, because many women prefer to have a partner and maybe get married later once she's emotionally
20
attached
years
to
or
them.
25 years, what is their idea about a partner? And it may vary, when she
change.
reaches 27 or 28,
It might actually
late.
change.
So
Yeah.
definitely that will help them.
So I think
be committed to.
Yeah, I think in
move
this
ahead.
changing scenario where most of the even Asian countries, women are studying more and planning to get into career, I totally agree with you that it is a good idea to delay the childbirth until a girl or a lady is settled at least somewhat in her life, and actually this is where we have the conflict with the science. Biologically they say that you have a lesser chance of having child, but I think you have to find a balance in this. You need to find a balance where it is not too late or not too early. So this is where you have to give enough education to the I would love to inform the girls who are in schools now that you have to plan your education as early as possible. Make sure that you have a good plan.
Education programs might help these girls to think in a different way.
They will definitely help, and then you settle well before you plan to have a baby.
Southend Fertility and IVF, where hope meets happiness. Established in 2001 and guided by care, ethics and expertise, Southend has completed over 10,000 ART cycles. It offers comprehensive infertility treatment for both men and women. Modern facilities and experienced team is the hallmark of Southend. The centers are at Vasant Vihar, Gurgaon, Saket, Paschim Bihar and Amritsar. Southend Fertility and IVF.
This program is brought to you by Southend Fertility and IVF.
I would like to have a clarity in matter what we discussed. We were discussing right now about it's better to have this girls to get settled and thereafter they can think about their marriage, so that they have a better understanding about their marital responsibilities as well. But we were discussing, we discussed already about there is a possibility of premature menopause.
Yes.
So how if marrying late and to how to be away from this menopause
that is a real
stage.
risk. Yeah, premature menopause. Premature menopause actually is a real potential risk for these ladies. Actually, what is premature menopause? We all know that women get periods regularly every month, only up to a particular age, and then once the number of eggs come down, the hormones come down, they stop having periods. So it usually can vary from around 45 to 51 years. Like our grandmothers used to get up to 51 years and so on. But nowadays the age of menopause is also coming down, and I have seen a lot of patients who go through menopause at the age of 35, 32, even at the age of 28.
Ma'am, is there any connection between this lifestyle of this present generation?
Definitely there is a connection between the lifestyle, but the problem here is that, like, if we say that, like, a woman can get mature, finish her career and then have her childbirth, what if she goes into premature menopause? What if she does not have enough eggs to have her own biological child? That is a real risk. So the answer that the science can offer is that we can evaluate these women to see how many more years they're going to have their eggs left. So we can do a couple of tests like the hormone analysis. We can do a scan to check how many follicles they have. It's called antral follicular count. And there is a blood test which measures the level of anti-Mullerian hormone. It's called AMH. So if we check the level of AMH, we will come to know the rough status of the women. So we will come to know how many follicles she will average have, and we also come to know that how many more years she's going to have her follicles. So we do have some methods to evaluate these women. So if there is any doubt, you can always have the AMH test, you can always have these hormone analysis, you can do a scan to do a antral follicular count. So these will be helpful in deciding if you want to delay your pregnancy for many years and all that. In addition to all these things, we have a lot of advancement in the artificial reproductive techniques these days, and oocyte freezing. Oocyte freezing is egg freezing. Oocyte freezing is a fairly new concept. What we do is actually we stimulate the ovaries to produce super physiological levels of eggs, like 10 to 20 eggs, and we collect these eggs outside the body through a scan guided aspiration. These mature eggs which we collect in the lab, we usually do in the IVF lab, these eggs can be frozen. It is a process called vitrification. So once these eggs are frozen, they can be left in the liquid nitrogen canisters for many years to come. So that means if a girl wants to get her eggs retrieved at the age of 25, that means when she has a good number of good quality eggs, she can do that if she wants to, in case she wants to have a child at the age of 35 or even 40, if she wants to delay the childbirth. So, this is a technique in which we can actually now give a practical solution to the women who wants to delay the childbirth. That doesn't mean that we all go and collect eggs from all the girls and freeze them and say that okay, you come back after 40. No, that is not the thing. I would suggest that this should be done for women who are at the risk of going into a premature menopause in one situation, because they may not even be able to wait till the age of 28 or even 30. So, if they have irregular periods, if they feel that they are not having enough ovulation, or if they feel that they are into a particular study or career in which there is definitely going to be delay, if you are planning to go to space, there are girls planning to go to space nowadays. If you feel that you might want to make a decision in future to have a baby, it might be a good idea if your career is going to make you wait till you're 35, 40, you might be able to have a baby later. So, you can go for a counseling to meet an infertility specialist or a specialist who are going to do this. There are ART banks also now. So, you can go for a counseling where they give you all the pros and cons of going through a procedure to collect your eggs and freeze it for many years. So, this is a practical option only, as I said earlier, not for everyone, but if you really feel that there is a risk of premature menopause, and if there is a risk that you may want to delay too much. So,
actually, it's a wonderful information actually, oocyte freezing. But I have a question, ma'am, whether it will affect the quality of the egg?
That is also true. You think that you have frozen eggs and you think, oh, I'm going to have babies at 40, and then you come back at 40, where are my eggs? And the doctor takes out, say, oh my God, they are all bad. What do you do then? It's a very good question. It can happen, it's not 100% sure that you may have all your good eggs preserved and you still have all your good eggs. The early years when we started egg freezing, the retrieval, that is taking it back from the frozen state, we used to get only 30 to 40% of recovery rate. That means there still are good eggs after recovery. But that has changed. Now, recent studies, I attended an embryology conference recently, they say that we are able to retrieve up to 80% of eggs in good quality now. So, 80% is just not that bad.
How long you can preserve the eggs? How long?
Now, the eggs can actually be preserved for any number of years. So, technically speaking, we can preserve it for 1,000 years. Or 50,000 years, but we do have rules that we should keep for around 5 to 10 years. But these rules are different in different countries. There are no rules in some countries. So, you might want to go to a country where there are no rules currently and then end up in trouble later when they bring in a rule. So, these things are new. These things need a lot of legal regulations. So, you have to be a bit careful when you go for these things.
Especially it's a wonderful information for ladies, because some girls, they wanted to go and do their studies in abroad, like in Canada and all, and they are not supposed to get pregnant for a 3 years.
That is so unfair. That is so unfair. I meet these women all the time. I meet these staff nurses who have to go and they have to do a pregnancy test to work abroad.
And then there is a bond that they are not supposed to get pregnant, before 3 years or something like that.
Yeah, I have seen that, and I think it's ridiculous.
For them, actually, this was
I think it's ridiculous. It is really ridiculous.
Solution, right?
There are a lot of things which needs to change, I guess. This is a natural process. Having a child, getting pregnant and going for a childbirth, these things are a natural right for a woman, and it is not right to take away that right. I personally feel, there might be a lot of different views and aspects. If you're running a business, I understand that if your employee is going to be taking off on maternity leave, definitely there is going to be difficulties in the work. I understand that perfectly well, but I think you can work around it, because personally what I have done is that when I was working in UK, I had my second son, and it was a wonderful experience for me. See, in developed countries, they give a lot of privilege to women while they are going through the pregnancy, and they give a paid maternity leave, maybe 3 months, 6 months or 1 year depending on the country. But it is a big boon, you know, to actually be able to look after your baby and then, you know, be paid, and then you be able to continue a job. And they usually they provide quarters, and you know, I was able to look after my second child even when I was working, because they used to give breaks to go and look after the baby or to feed the baby. So from my experience in UK, what I have done in our institutions, we have, you know, the hospitals in South India, in Cochin and in Bangalore. What I always try to do is that for my staff, I want them to continue to work even while they're pregnant, and I try to reduce the number of working hours for them. I give them part-time jobs, and after delivery I usually ask them to come back to work and do part-time jobs. So I give them couple of hours work in the beginning, so that they're able to continue the work without a break, or to actually look after the child and feed them until they are comfortable. So, you know, I have a staff, Kavita, now just started again in Bangalore. She delivered a baby 3 months back. I gave her enough time to come back to job whenever she wants to. Now she comes around 10 o'clock, she'll do her main work. She's an excellent assistant in laparoscopic surgery. She does her main work, and then she'll go back at 12. So she works only 3 hours. Then she'll feed the baby, take a break, and then come back in the evening for 2 hours work. So it works out very well. You know, the other staff will be able to cover up for her absence. So she's actually able to do a part-time job. I feel that most of the institutions are actually able to do it if you work around it. It is practically possible. I have done this for the last 15 years and it worked wonderfully well. So it's only a matter of, you know, doing it. You know, that's, it has to come. But, some managers needs to be take time to do the rota.
Southend Fertility and IVF, where hope meets happiness. Established in 2001 and guided by care, ethics and expertise, Southend has completed over 10,000 ART cycles. It offers comprehensive infertility treatment for both men and women. Modern facilities and experienced team is the hallmark of Southend. The centers are at Vasant Vihar, Gurgaon, Saket, Paschim Bihar and Amritsar. Southend Fertility and IVF.
This program is brought to you by Southend Fertility and IVF.
Unfortunately, the employment rules and regulations are not favorable for an employee who is pregnant in many of the countries, right?
That's very true. I think we need serious changes. Because there are a lot of issues which needs to be addressed and changed. But there are definitely good changes being seen in some Western countries, which is really, you know, appreciable.
Ma'am, this egg freezing is a wonderful technique, but many of the youngsters are not aware about the same, and you know, they lose this chance, and later on they realize that they are affected by some, you know, infertility issues. And how could you help them actually when they are approaching you?
Yeah, that is also correct. Like, you know, many people are not aware of egg freezing, and we do get lot of couple coming in because they're planning for a child at the age of 30-35, and then they are not able to have them. So what we can do is that medically we may be able to help these couple. There are various medicines that are available. We can do various procedures to help these people. So if they have not been trying for too long, we can try and increase the ovulation chance by giving medicines to produce ovulation. And in addition to that, there are procedures like IUI, which is intrauterine insemination. That means we can increase the chance of conception by doing procedures like IUI, where we inseminate artificially by preparing the semen sample in the lab and injecting directly into the uterus. In case these IUI procedures fail for multiple cycles, we can do artificial reproductive techniques. There are procedures like IVF, ICSI, and embryo freezing, which can be offered to these couple, and in case they have just a few number of eggs left, we may be able to get a successful pregnancy out of that. Sometimes women have completely depleted egg reserve. They come to us in a stage where they have gone through menopause. In those women, it is very difficult to achieve a biological pregnancy. So in those cases, we may have to depend on an egg donor. That means we have to use the donated eggs and the husband's semen sample to produce a donor embryo, which will be inserted into the woman's uterus, and she can still have natural childbirth, but the genetic child will be of a donor. So it is possible to have a child at any age if you are flexible in these aspects. Nowadays, we even have women without the uterus, either by birth or if they had it removed by surgical removal of the uterus, which we call hysterectomy. Even women who don't have the uterus are able to have a child through the process of surrogacy. So we can offer a lot of procedures to these couple who have difficulty in having children.
It was actually a reassurance that instill hope among people, right? So ma'am discussed about various alternative solutions to various infertility issues. So we'll look more detail into these techniques in future episodes. Thank you so much.
Southend Fertility and IVF, where hope meets happiness. Established in 2001 and guided by care, ethics and expertise, Southend has completed over 10,000 ART cycles. It offers comprehensive infertility treatment for both men and women. Modern facilities and experienced team is the hallmark of Southend. The centers are at Vasant Vihar, Gurgaon, Saket, Paschim Vihar and Amritsar. Southend Fertility and IVF,